am a primary care provider. I'm used to talking one-on-one to people. I am not a professional presenter, so I'm gonna pretend y'all are all my patients. It'll make it easier for me. So I talk about this every day with my patients, every single day. So I'm hoping I'll do a good job and help y'all learn a few things. Next slide. Okay. So we're gonna talk about what is it? Who's at risk? What are you gonna do about it if you do have heart disease? And what we can do to prevent it too. So heart disease is coronary artery disease, which is the disease of the blood vessels that are affecting your actual heart muscle. Every time your heart pumps, your heart muscle, the first place it goes to is your heart. Then it goes to your brain and the rest of your body. So your heart muscle is very important. That comes into a heart attack. So heart attack is where your heart muscle is not getting enough blood, so it stops working, right? Heart failure is where it's pumping so hard, it gets big. We don't want our heart muscle to get big. When our heart muscle gets big, it fails and it doesn't pump appropriately. Arrhythmia is like irregular heart rhythm, like AFib, VTAC. Of course, again, where you're not getting enough blood flow everywhere. So this is what the heart disease rates look like in the country. We need to live in Puerto Rico and Hawaii because they have a lot less heart disease. North Carolina looks pretty bad, and Columbus County in 2000, oh wait, that's the next slide, sorry. The next slide. So I'm skipping to the bottom. Columbus County was ranked the least healthiest county in North Carolina from 2009 to 2015. That's really sad. And we're going to talk about that in a little bit. So that's how many people in 2022 had heart disease and they died. So 17,000. Can y'all hear me? Okay. I told you I'm not good at it. So these numbers, you can all read those. They're high. That's not good. We've got to do something better. And heart attacks can be silent. Women have different symptoms of heart attacks than men do. So men are like, oh, I have chest pain, I'm elephant on my chest, this isn't good, I need to go to the hospital. Women, we're tough, right? So we could have indigestion, we could have jaw pain, we could just not feel good. So risk factors. So we all know these: high blood pressure, high cholesterol. How many people have high blood pressure? Pretty much all of my patients. High cholesterol, very few patients have low cholesterol. Smoking, I've smoked for 30 years, why would I change now? Diabetes affects the small blood vessels in your body, so your eyes, your kidneys, your hands, your feet, so think about what it does to your heart. And then obesity, think about every 10 pounds that you have extra is 1 mile of blood vessels that your heart has to pump through. That's a lot. So that puts more strain on your heart. So what increases my risk? So your blood pressure. Guidelines have changed a little bit. If you're 130/80, you're actually very borderline. You're actually in stage 1 hypertension. So we want to be less than that. We want to be like 120/70 or less. Total cholesterol, LDL. Total cholesterol is, the whole nut. LDL is greater than 100 if you are high cholesterol. Actually, that's changed too. They actually want you to be like 50, which is, I'm not even 50. But we got to work on that. LDL is the bad cholesterol, so that's what kind of causes the plaque buildup. HDL is your good cholesterol, so that's what helps fight against the bad cholesterol. That's what helps keep you healthy. Diabetes, you go to your doctor, your A1C greater than 6.5. That's an average of your total blood sugar over 3 months. So it's not just what you are today. So it kind of tattletales on you. So if you're like, oh, my blood sugar is great today, we can see what you were 3 months ago. Smoking, and then inactivity. So what are we going to look for? So early coronary artery disease. Most people can walk around with a high blood pressure and not even know it. They come into my office and they're 200 over 100, and I'm like, do you feel bad? Do you have a headache? Do you have dizziness, vision changes, chest pain? They're like, no, I'm good. And they've been like that for 10 years. And I'm like, oh, that's so good. So early signs of high blood pressure could be like chest pain without movement, shortness of breath, palpitations, dizziness. And then of course, a lot of people don't even know they have heart disease until they've actually had a heart attack, which is what we need to raise awareness about. So when you go to the doctor, hopefully, they check to make sure if you have high blood pressure, high cholesterol. Have you been having some shortness of breath going up the stairs? That might not just be an inactivity thing. It might actually be a heart problem. You should be getting EKGs at your regular doctor's office. If you're not, you can ask for one. That could be a part of your wellness exam. Abnormal labs, there's a couple labs that we can do, not just your normal kidneys and liver and electrolytes and cholesterol. We can check inflammatory markers like that CRP, inflammation in the body is where a heart attack can come from. And then there's this new test, it's called a calcium score, and it's a CAT scan that can see how much calcium buildup you have in your heart. And that kind of correlates with high cholesterol levels too. So if you're high cholesterol and you have these high calcium scores, then they'll more than likely put you on cholesterol medicine and talk to you about a heart healthy diet. So what happens with a heart attack? So like I said, with men, they have the normal heart attack symptoms: chest pressure, feeling like an elephant's on their chest, they can't breathe. Women, I'm going to use my mom for an example, and I'm glad she's not here. She had indigestion, and she felt like, her gallbladder was acting up. And actually the ENT was like, yeah, your gallbladder, it's probably your gallbladder. So we went to the hospital, and the doctor was surprised that she had actually had a heart attack. So women, indigestion, jaw pain, just stomach upset. You might get a little short of breath, so watch out for those symptoms too. So heart failure. So heart failure, if you have any of these symptoms, sometimes we swell at the end of the day. That can be normal, but I do suggest that you still talk to your doctor about that. Swelling is too much fluid, and your heart is not pumping the fluid around like it's supposed to. Shortness of breath whenever you go upstairs or just go from here to there. Weight gain. So it's not normal to gain 5 pounds in a day. So no, you don't have to weigh yourself every day. That's crazy. But if you notice, like, gosh, my face is really puffy today, kind of keep a check on that. Or if you have a family history of heart failure and you have other risk factors like high blood pressure, high cholesterol, and even a cough. So some of my patients come in and they aren't overweight, they don't have swelling, but they have this naggy wet cough that they've had for months or years. And they're like, well, I'm a smoker, it's probably my smoking. But it can be from fluid buildup in the lungs, because the lungs, your heart's pumping blood to the lungs, and it can get congested there. So again, if you have symptoms of heart failure, we can do a few things in the office. We can do some labs. The ProBNP is a lab. We call it the heart failure lab. But you're going to end up going to cardiology. Hopefully nobody's going to end up going anywhere. But they do an echo, which is like an ultrasound of the heart, and that sees how well your heart is pumping and if it's big. Again, we don't want a big heart muscle. We want big glutes and thighs, but we don't want a big heart muscle. So then the next one is irregular heart rhythm. Some people, again, have no symptoms. I've had patients come in and I did an EKG, and their heart rate was 120 and they were in AFib, and I'm like, do you feel okay? And they're like, I feel fine. So you can feel like palpitations. Palpitations means like little flutters. You can kind of feel like it takes your breath away. You just feel dizzy. And then again, no symptoms. But AFib's your big one. AFib is where your heart is not talking to each other. The top part of your heart and the bottom part of your heart are kind of quivering. And so the blood is not pumping to your heart, your brain, and the rest of your body. And what that can do is create a clot in there, and the clot will break off, come up into your heart arteries, and cause heart attack or stroke. That's why we don't like AFib. All right, what can you do to prevent it? There's a lot you can do. So you can, of course, go to your doctor and get your yearly physicals. What we normally do at these physicals, or what I normally do at these physicals, is you get an EKG. That just gives you a baseline. Look at your heart. That is only 6 seconds of your heart, though. So, like, tonight you might have palpitations, and we didn't pick up on it because it's just 6 seconds. The chest x-ray, that will actually look at the size of your heart. If your heart is enlarged on the chest x-ray, that'll alert us, like, hey, maybe she has heart failure. Let's look a little further into that. When we listen to your heart, we can hear abnormal heart rhythms. We can see if you have swelling. Swelling in your legs that's concerning is pitting edema. So when you stick your finger in your leg and it stays there, that's concerning. You know, a little ring where your sock is not so concerning because that's been there all day. All right, so you gotta stop smoking. Smokers for 30 years, they're like, I can't quit. Well, you can, because your lungs can regenerate. They can repair themselves. That's why when people stop smoking, they start hacking up this nasty stuff. That's because their lungs are actually starting to work. We're going to talk about foods in a minute, because that is like my favorite thing to talk about is nutrition. Losing weight, which kind of goes hand in hand with nutrition and walking more. So what you can do, if you're like, I don't have time to work out, well, instead of taking these elevators, we can all take the stairs. We can park further at the grocery stores, and we can try to get like 10,000 steps a day. You know, you don't have to count steps. Just walk a little further than you're normally used to. And stress. What do we do about stress? I don't even know, because this, I mean, everybody has it. We need to slow down. We really need to slow down and smell the roses, get outside more. We need to make our schedules less busy, because every patient that I see is just like, my job is so stressful. I'm so stressed out. And I'm like, well, blood pressure, you're eating bad, so diabetes. So that's something we all need to work on. All right, so if you already have it, this is what we're gonna do. You need to keep up with your primary care doctor. They manage your blood pressure, they check your cholesterol, so we like to check cholesterol, A1C, and all that every 3 months. The reason why is because things can change in 3 months. We don't do it any sooner than that, because again, the A1C measures your average blood sugar over the 3 months. If you have coronary artery disease, I do suggest, I send my patients to cardiology, because it's nice to have 2 people looking at you, right? Cardiology is the specialist. They're gonna do the echocardiogram or the ultrasound of your heart. They're gonna do the stress test that everybody loves, where you're running on a treadmill and feel like you're about to die. Or you may end up needing a cath. And that's really the only thing that you can do for coronary artery disease if you have stenosis that can cause a blockage. There is cardiac rehab, where you learn how to do exercises that's healthy. And Micah can talk about exercise when he gets here. And then there's an electrophysiologist, a big long word for a heart doctor that manages AFib, so irregular heart rhythms. So basically keeping your appointments, go to the doctor. I know we're not fun, but it helps. So, if you or your patients or your friends are smokers, there's things that they can do to help. A lot of times smoking originated from an oral fixation, because you know they're just used to doing like this. And when people quit smoking, what do? They start eating, or they chew gum. They do something orally. So you can do gum, you can do patches. There's Chantix. We even do off-label Wellbutrin. They can go to therapy to learn other coping skills, because a lot of times smoking is a coping skill, and we want to change that. All right, so exercise. We talked about walking. So weight-bearing exercises are my favorite, because I don't know if you're like me, but I hate cardio. I really hate cardio. So weight-bearing exercise, what does that mean? That means the same things that you do every day, going from sitting in a chair to standing. That's called a squat. So you could just do normal squats. I had a patient tell me the other day that she does 10 squats every time she goes to the toilet. I'm like, that's actually not a bad idea. That's a lot of squats in a day. And, you know, even calf raises, just sitting here, just doing calf raises. Actually lifting weights. No, you don't have to do it like a man, but that helps with your bones. that helps get your blood pumping without you having to get short of breath by running, because the only time I'm running is if I'm running from a bear. So that also helps prevent osteoporosis, so you're killing two birds with one stone. And then yoga for stress relief, or just general stretching. So when you get out of the bed in the morning, you take a big stretch. You stretch your back, which we all need that because we all have muscle spasms in our back. And just breathing, even meditation. I don't know if any of y'all meditate. I don't really meditate, but I do take a moment sometimes to just kind of breathe and just not think of anything. I cut my brain off and just breathe to try to manage the stress. All right, so my favorite topic, I could probably talk about this for a whole hour. Nutrition. So what does Whole Foods mean? When I talk about Whole Foods patients, they're like, oh, what does that mean? I don't even know what that is. Basically, you eat like your grandma used to. They grew their own food, they raised their own food, they did not go to the grocery store or fast food to get all this processed crap. We love it, it tastes really good, and they designed that on purpose. So Whole Foods is your regular veggies, your regular fruit, your meats, your dairy if you're not allergic to it. Eggs are okay, so we'll talk about that too. So I tell my patients when they go to the grocery store, you go to, I'm at Food Line, so the stuff's over here. Go to the grocery store, you go to the veggies and the fruit, you buy your veggies and the fruit, then you go to the meat, you buy your meat, and then you go to the dairy. You can go down the frozen aisle, that's fine, because frozen veggies are okay. All the middle aisles, avoid. They're all processed. That's fun, isn't it?
You gotta buy coffee.
Well, you know what? You can buy your coffee and your tea, but it has to be black coffee, not a bunch of fake creamer, right? That's fun. You got me there. And like your rice, your wild rice, you can do that too. That's that one aisle you're allowed to go on, and they're like, "What?" I'm like, "Yeah." So your canned veggies, they're processed. They're full of salt. So your cereals, y'all, Cheerios is not healthy. It has a heart on it, and I hate that, but it's not healthy. So speaking of Cheerios, so that is a carb that turns into sugar as soon as you eat it. It has no nutritional value. So instead of eating that carb, you should eat a complex carb like a potato or a sweet potato. Yes, potatoes are healthy for you. They have minerals and vitamins in them. And then wild rice. Our town has, I think the reason why we're so unhealthy is we have so many great fast food restaurants. And even Zaxby's, you know, you think, oh, it's healthy, it's like salads and chickens. Have you looked at their salad? It's 1,200 calories to eat a salad. And I was like, well, crap, that's my whole day. I could eat a lot of food if I didn't eat that salad. So we need better restaurants, or we just need to cook it at home. I was like, man, if somebody could create like a meal prepping, you know, diner here where like you pick up your meals for the week. Here, I've already made them for you. So somebody do that and you'll be a very rich person. Sugar. So sugar, when we eat it, causes inflammation. And I do think that there's research that sugar does create inflammation in the arteries and the veins. It's not just your cholesterol. So that's why we like, you know, if you are diabetic, we like your A1C to be a certain level. But then again, I don't like fake sugars either. So fake sugars are really bad for you. So don't replace regular sugar with fake sugar. Let's just limit it all. Seed oils. Does anybody know about seed oils? You know what that is? So your, you know, canola, vegetable, help me out here. Olive oil's good, but it depends. So olive oil, avocado oil, and coconut oil are your best healthy oils. The problem with olive oil is they have watered down olive oil with vegetable oil now, because there's not enough olives in the world to make the oil. So you have to be careful what you buy. When you pour out olive oil into a little cup and put it in the refrigerator, if it congeals like butter, that's good. If it stays a liquid, that's got bad oils in it, unfortunately. Learn something new every day. And I was so mad, I bought a whole thing from Costco.
How about if it's such pure olive oil?
Test it. Test it. Because when you look at the back, if it's from 5 different countries, it's got something else in it. It has, like sometimes it'll say made in Italy, and there'll be nothing else in there, and it says it's, perfect. Still test it.
What about the sugar substitutes? Do they bring a difference too? Like the yellow pack, the blue pack, the green pack?
So, and I don't know who's who, but I know the I don't know the colors very well, but they actually are not good for diabetes either, because they cause inflammation too, because they tell you, oh, don't eat sugar, eat these fake sugars. Well, that actually causes inflammation too, and can actually affect your sugar. So,
So wait, I got one more question.
yeah,
Since we're talking about it.
we can talk about this all day. Five.
She just blew up my picture from the Cheerios.
Oh,
So I've got Cheerios in both.
I can blow up everybody's picture.
Okay, so I ain't gonna go there, but what about the drinks that say no sugar? Y'all,
Do you really want to go there?
no, never mind, it's all right. Never mind.
Avoid food. So that's all processed though. Remember, you don't go in those aisles. They're not allowed.
Right out of water.
Oh, well, so avoid anything that says no sugar added, because that means it's got fake sugar in it. Obviously, because if it's sweet, it's got fake sugar, right? Well, I mean, stevia and, what's the other one, monk fruit are now the new sugar replacement, because they're like 0 calories. It's not as bad for you as Splenda. Yes. It's not as bad for you as those, right? I've just gone down my own rabbit hole, and it's used in other countries. This is awful. Used in other countries as birth control. So I'm like, I don't know, is it good for you? I'm not sure. So the jig is out on that one. But yeah, so if you can just try, and once you do a sugar detox, honestly, sweet craving, right? After about 3 weeks, you don't even crave it anymore.
Do you prefer like pure cane sugar instead?
So if you can get the unbleached pure cane sugar in moderation, honey, moderation is key. Honey or maple syrup are actually your only 2 natural sugars.
What about agave?
I think that one's okay too. But still, like baby doses. But again, just remember that one causes inflammation. So for everybody that has arthritis, limit the sugar. Yes, ma'am.
Fruit has a lot of sugar, but it's like good sugar.
So fruit to me is different because it has so many other vitamins in it. Now, if you're diabetic, you do need to limit fruits. Your berries and your pineapple is very high in sugar, but it has the biggest bang for your buck. So if you're not diabetic, pineapple's great. If you are diabetic, you need to stick to more of the berries, but again, in very moderation and monitor your sugar. But fruit's different. But people are scared of fruit because it does have natural sugar in it. But that's not what makes people gain weight and have diabetes. Yeah, this stuff is hard. Somebody else? Yes, ma'am. Yes, honey and maple syrup are like, they're made by nature, so they are perfectly fine.
Because I can just have like honey for coffee.
Yes, and that's great. And do you put creamer in it?
Is I do creamer, I don't use any type of sweetener, the creamer itself is sweet.
Right. Yep. And then creamers, you gotta be careful about.
Non-dairy? The non-dairy creamer, is that what it is?
It just depends. Like, now oat creamer is very carby, so that can jack your sugar up too. We haven't even gotten to the question part yet. And then more water, of course. Everybody says, you're supposed to drink half your body weight in water. So if you weigh, 200 pounds, you're supposed to drink 100 ounces of water, which is hard to do, and everybody's doing so good today. For every cup of coffee, I'm not picking on you, I'm just saw your coffee. Every cup of coffee, you need to drink a whole bottle of water because coffee is dehydrating. All right, so we're gonna eat healthier, and we can talk more about that if you want to, I'm game. Move more, go to your doctor. Family members. Who has family members that are so stubborn and they don't listen to you? Everybody. Guess what? My mom's the worst. Me and my sister both are nurse practitioners, and my mom will not listen to us at all. So it's time for us to, spank her. Hold your family accountable even if they get mad at you, because you're their best advocate. And if anybody ever had to go into the hospital because of one of these things, go with them and be their advocate. Tell on them, be a tattletale, it doesn't matter. Some of my patients will not tell me anything, and I'm like, I know something's going on. And then the wife will come in and they're like, yeah, he does this, and this, and I'm like, you come and tell me these things because you're a team. So get your provider that you can be a team with and you can joke with, because life is too serious anyway.